Have no idea how to become a tougher nurse? I'm going to share with you the 5 ways I became a tougher nurse, especially when working in the emergency department. Hi, I'm Nurse Tracy of Resiliency Within, and if you haven't subscribed yet, please do so and hit that notification bell so you don't miss out on another video on how to live beyond burnout. When we hear people say that they work in the emergency room, we think, wow, that's a tough nurse. And it definitely threw me into the deep end, helping me build resilience, resourcefulness, and a thick skin. Here are how my ED experiences can make you a tougher nurse. I've helped myself and other nurses live a life with resiliency within and deal with nurse burnout. Tip 1. Dealing with verbally abusive patients. Yes, there are so many of them, and I'm sure you have tons of stories. And maybe this happens just once a day or many times a day in your shift. The key is to develop good de-escalation skills. In the emergency department, and not only in the emergency department, but all parts of the hospital, patients can get a little tough, especially when they're experiencing pain or fear or have an altered mental status. So I've learned how to de-escalate situations using only verbal skills. And it's important to set clear boundaries while maintaining empathy. And I'm sure that you've recognized, oh, that patient's going to start escalating, or their family member even. So one example that's worked for me is to acknowledge and validate. Hey patient, I can see that you are really frustrated or upset or angry, and it's understandable that you feel that way in this situation. With that statement, I avoid saying, hey, calm down, hey, relax, hey, we have to wait our turn, hey, there's another emergency, because that's being dismissive to the patient's needs and feelings. And just add a statement of empathy. I'll say something like, I cannot imagine how difficult this must be for you. Or I can also say, it sounds like you've been through a lot. Also, when we're being yelled at, it takes an emotional toll. And over time, we have the ability to build emotional resilience. For me, it was to not take it personally and just know that the verbal abuse is coming from patient's distress, and knowing that it's not a personal attack on me or who I am. And this thickened my skin and protected me against burnout. How about if somebody's waiting for a long time and they say to you, this is ridiculous. I've been waiting for hours. This hospital and you nurse is a joke. So rather than being argumentative or pointing something out to the patient's attention of other people's needs, I just take the car that they're driving and ride along in it by saying, I can see that you're very frustrated, and it's understandable that you feel that way because you've been waiting for so long. Tell me more about what's happening. And just pause and just let the patient get out, or their family member get out, all the things that's bothering them. And how about for the case of a patient who's waiting for a bed? Normally I would say something, I understand you'd like to know when your room will be ready, and I appreciate you bringing that to my attention. And I just pause and I just let the patient do all their venting. Again, I'm not trying to fix anything here. There's nothing that I can fix. These things are out of my control. And in another video, we talked about how not having control can lead to burnout, especially over chaotic situations. So just realize, I'm not in control of this situation. There's nothing I can do. All I can do is go along with this patient and let them fully vent their feelings. But another example, when I worked in the emergency room at night, we didn't have the kitchen open, so it would have to just be a cold turkey sandwich, the infamous turkey sandwich. So when patients ask, I want a hot meal, I demand to have a hot meal, this is what I would say. Unfortunately, we cannot give you a hot meal right now because the kitchen is closed. However, here are some other options we can consider. You can have a turkey sandwich, or you can have a yogurt, or you can have graham crackers, or you can have juice or milk. This way, this allows the patient to return some sense of control to themselves by choosing which of these items that they can eat. But at the same time, you're setting a boundary. And the ED forced me to become assertive. I learned to stand my ground, to advocate for my patient or their family member, or to even advocate for the things that I was critically thinking about for the patient's needs. And I'm sure you know, as a nurse, there's been times where you had to stand up to the doctor or the ordering provider to present the case of what you thought is more important to order or what to add on. And that leads us to tip 2, advocating for patients. I learned to become a master negotiator in the emergency room. I started developing skills at negotiating with physicians to make sure that the patient's needs are met. Even if it comes to something as trivial as ordering a diet, that has to be in the computer, that has to be entered. So learning how to tactfully say, hey doc, could you throw in an order for me? Thank you, I'm not able to do it. And working in the ED, it really exposed me to the inadequacy and flaws in the system. Mainly because I was able to see some patients were able to get the care that they needed, while others, they could be homeless or close to being homeless, really weren't getting the care that they needed or the preventative care that they needed. And instead of giving them a lecture about how to use the emergency room, that the emergency room's only for emergencies, just letting them know and thanking them that they took time to take care of themselves and their body at a time that they were able to do it. Because a lot of times people are working a lot and they put their health on the back burner. Nurses are a good example of that. So when there is time, maybe they show up to the ER at midnight for a medication refill. So it's important, and it's helped me a lot, to avoid blaming the patient, avoid giving them a lecture about it, just fulfilling the orders that they need, give them what they need, make sure that they have everything that they need in their discharge paperwork, and giving them really good discharge instructions. If any of this is resonating with you, hit that like button, and please comment below on what makes you a tougher nurse so that we can all learn about it. Tip number 3, dealing with 5150 holds. Being with people on a 5150 is often the most difficult thing an ER nurse has to deal with, and a lot of times we're holding on to them for a long time, sometimes many hours, sometimes many days, until there's placement for them. I learned the importance of safety. Anytime I go into a room of somebody that's on a hold, I make sure to clear the room of any wires or cables, and that includes the wires on the telemetry machine and all the cords for the pulse ox. I even remove the blood pressure cuff, make sure all the cabinets are locked in the room. I remove any pens in my pocket and my name badge, especially if my name badge is around my neck on a lanyard. I remove that too. Anything that could be used for potential harm has to come out of that room. So I made sure to have that as a habit, just to double check everything in the room, and the room was completely clear of everything. And maybe even the garbage. Maybe the garbage needs to be moved to the outside of the room. And just making sure to always check back in with the person on the hold. Even though maybe I will be in the care of that person for a full 12-hour shift, it's important to me that I keep going in and checking the room, because people on holds can escalate quickly. So as long as I'm still in the room talking, making sure I'm listening to their needs, allowing them time to vent, gives them some sort of interaction with someone else, so they're not in that room ruminating on thoughts or hearing or seeing any hallucinations or delusions, to keep them in touch with reality. And the most important thing for me was to build empathy with anyone on a hold, just to realize, hey, we have a shared humanity, maybe we're not that much different, and know that any mental condition can happen to any one of us at any time. And so that really softened me into my interactions with people on holds. Tip number 4, staying on top of a busy assignment. I think that must be the hardest thing for a nurse to learn how to do, especially when first coming out of nursing school. When I was in the float pool, I've also precepted nursing students, and we went to all the units in the hospital. But every time we went to the emergency room, my preceptee often begged, no, please, let's go to med-surg. I don't want to go to the ER. I don't know what I'm doing there. And I get it, because the ER is a place where there is no sense of order. But yet there is, right? Where it's constantly chaos all the time. New orders are coming in, assessments are happening all the time. everything's in a more fast-paced fashion. But over time, it made me so much better at staying organized and at prioritization. So when I get a new patient in one of my rooms, I do have an order of how I complete the assessment and begin the first few tasks. And then it's important to also keep rounding on my existing patients, checking their orders. And this is like riding a bicycle or playing a piano, just the practice over and over again of prioritization, time management, quick assessment skills, where to focus my attention on. Doing this for years and years made me become so great at all these skills. And I started using tools and strategies around me to help keep time management. Sometimes I would have to set an alarm on my phone if I have to go back and do a reassessment on pain. Maybe there's a code STEMI or a code stroke, and using my timer to keep track of all the milestones that needs to be met in these algorithms. And lastly, tip number 5, taking breaks and actually taking them. Working in the ED, it can be a fast road to burnout. So it's important to prioritize self-care, taking breaks. So often, many nurses that I've worked with often skip those smaller breaks, those 10 or 15 minutes breaks. And those breaks are so important, because what I did is I would take those little breaks and I would find a bench outside to sit in. If it was a night shift, then I would find a bench somewhere in the lobby of the hospital to go sit in, just so that I'm away from the alarms, and I practice some deep breathing, some mindfulness, and sometimes I watch some cat videos on YouTube, and that renewed me enough so when I came back to my assignment, I was in a good mood. Now, if you happen to be in a place that doesn't prioritize breaks, my heart goes out to you. So see how you can get some little micro breaks in. Is that going to be in the clean utility room? Is that going to be in the pantry where you can get away and take 5 deep breaths? Is it something that you can ask the charge nurse for? Like, hey, I really need a break relief. Can you send somebody right away? No one would say no to that. They would maybe say not right now. And then you say, follow up by saying, let me know when that happens, because I'd like to have my mandated break. And that's how you can set aside protected time for your break, letting them know that it's your right as an employee to have breaks, and be okay with letting go of responsibility. You know, we clock out at the end of our shift too, so we don't stay at home thinking, oh, how can I still take care of that patient? And I hope you don't. If you do, I have some other videos on how to release a busy shift at the end of the day. But be okay with leaving the unit for 10 minutes to take a break and let somebody break relief you. We talked a lot today about how the emergency department made me a tougher nurse, and I want to make sure that you know I'm talking about toughness and not hardness. It's not a sense of being callous or uncaring. It's about developing resilience, developing skills, and the self-awareness needed to practice self-compassion, and awareness to practice compassionate care, especially in a challenging environment. And it's about ways to manage stress in the moment with the techniques that I've given you, and how to set boundaries for yourself and advocate for your patients. It's more about becoming stronger, more capable, and a more compassionate nurse. Need help in tackling burnout in your life? Go to the description box in the link below where I have my free Resilient Nurse Toolkit, and also I have a free tip sheet, de-escalation tip sheet. It has some common scenarios that will help you turn around an escalated situation so that both you and the patient feel a little bit more in control of the situation, no matter how hopeless it seems. Be sure to check out the next video, a before shift meditation practice of 6 minutes, so that you can start your shift feeling refreshed and ready to go with a smile on your face. See you in the next video.